Hi all, welcome back to Family Planning and Abortion for Medical Students. Today I'm going to be talking about the epidemiology of people who choose abortion, as this is a controversial and highly politicized topic. I will also be sharing resources for non-directive abortion counseling. Today's video will not address a specific APCO objective, but will ground the subject of abortion for our next video and allow students to confront and acknowledge any biases or incorrect information they've previously encountered regarding patients who seek abortion. These are our learning objectives today. This video will be a brief introduction and clarification of the demographics and circumstances of people who seek abortion. I will also provide resources to learn more about non-directive counseling methods for abortion and contraception, as my limited experience would not do this important subject justice. Most of my statistics today will be from the Guttmacher Institute, which is also in the resource folder for this video and a great source for abortion statistics and graphics. Okay, so let's start with this. Who chooses abortion? This is one of the really great graphics I was talking about from the Guttmacher Institute that gives us a lot of information. As you can see, the majority of U.S. abortion patients are poor or low income and under the age of 30. It is also interesting to note that the majority of these patients are religiously affiliated and already have a child, as a common myth about abortion patients are that they are not religious, that they hate children, or they do not currently have any children. As you can clearly see, the majority of people choosing abortion already have a child and/or have a religious affiliation. In regard to race and socioeconomic status, disparities regarding abortion are linked to higher rates of unintended pregnancy, which reflect a greater issue of lack of access to affordable health care and contraception, as we discussed in our last video. Another statistic from the Guttmacher Institute that is not in this graphic but worth mentioning is that 51% of patients obtaining abortions were using some form of birth control in the month that they became pregnant. Most of these patients were using barrier methods or short-term contraceptives. This is important to remember when counseling a patient on abortion. Almost half of these patients were actively attempting to prevent pregnancy and still became pregnant, which is one of the reasons why remaining non-judgmental is extremely important. Another important statistic is how common abortion procedures are. At 2014 abortion rates, 24% of women in the U.S., or approximately 1/4, will have an abortion before they turn 25, although this number has been trending downward in more recent years. Although abortion is often thought of as a taboo or rare procedure, that is simply not the case. It is important to note, however, that while abortion is a fairly common medical procedure in the U.S., with over 860,000 performed in 2017 alone, the abortion rate was also at a all-time low in the same year, at 13.5 abortions per 1,000 women aged 15 to 44. It is also imperative to understand the safety of abortion procedures. Elective abortion is a safe procedure and is actually safer than carrying a child to term and giving birth. A 2012 study published in Obstetrics and Gynecology showed that the pregnancy-associated mortality rate among women who delivered live neonates was 8.8 deaths per 100,000 live births. The mortality rate related to induced abortion was 0.6 deaths per 100,000 abortions. I will talk more specifically about the safety of abortion procedures by trimester and procedure type in the next video. Next, we should talk about some of the reasons why people choose abortion. A 2017 review in the journal Contraception looked at reasons for abortion in 14 countries, including the U.S. The most common reasons stated in the U.S. for abortion were if the pregnant person was too young, had socioeconomic concerns, wanted to postpone or space children out, or did not want more children in general. Other reasons cited in smaller numbers in the U.S. and greater numbers in other countries included partner-related issues, risks to fetal health, and risks to maternal health. While every person is entitled to an opinion on the reasons to choose abortion as listed above, I want to point out that there are many reasons people seek abortion, so it's important not to make assumptions when counseling patients on or speaking with a patient who has chosen to have an abortion. I want to end this video by saying that abortion is a common medical procedure, and it is on us as medical students and future physicians to help remove the stigma and biases associated with this procedure. Regardless of medical specialty, you will encounter patients that have chosen or will choose to undergo an abortion in their lifetime, and you need to know how to speak to these patients with empathy and respect. If you plan on going into the fields of OBGYN, family medicine, or pediatrics, you should also be able to counsel patients on their options when it comes to their pregnancies. I have linked resources including videos and documents that can help you learn how to counsel patients on this decision while respecting their autonomy. Thanks so much for listening. Be sure to check out the resources and articles in this section's folder for more information. The next video will discuss the two major methods of pregnancy termination and their complications.